Hello fellow humans, welcome to our list of the top 10 most common causes of death for humans as of 2024. Have you ever wondered what poses the greatest threat to human life? In this video, we will delve into the data and reveal the leading causes of mortality that impact people around the world. From diseases to accidents, the list is both eye-opening and crucial for understanding the risks we face in our daily lives. Stay tuned as we uncover the top 10 things that kill humans the most as of 2024, shedding light on the factors that can significantly impact our well-being and longevity. Let's explore the statistics and insights behind these sobering realities. Number 10. Tuberculosis. Tuberculosis, often referred to as TB, is a bacterial infection that primarily affects the lungs but can also target other parts of the body. Despite advancements in medical science, TB remains a significant global health concern, particularly in regions with limited access to healthcare. This infectious disease spreads through the air when an infected person coughs or sneezes, making it highly contagious. The symptoms of TB include persistent cough, weight loss, and fatigue. While effective treatments exist, the rise of drug-resistant strains poses a challenge in combating this disease. Tuberculosis ranks at number 10 due to its widespread prevalence and the ongoing efforts required to control its transmission and impact on public health. Number 9. Diarrheal diseases. Diarrheal diseases encompass a range of conditions that lead to frequent loose and watery bowel movements. These illnesses are often caused by viral, bacterial, or parasitic infections and can result from contaminated food or water sources. Diarrhea can lead to dehydration and electrolyte imbalances, posing a significant risk to vulnerable populations such as young children and the elderly. While preventable and treatable, diarrheal diseases remain a major cause of morbidity and mortality worldwide, particularly in developing countries with inadequate sanitation and hygiene practices. The ranking of diarrheal diseases at number 9 highlights the ongoing challenges in addressing these preventable illnesses and the importance of access to clean water and proper sanitation in reducing their impact. I guess dying like this can be somewhat shitty. Alright, let me stop on the next one. Number 8. Road injuries. Road injuries, including accidents involving vehicles, pedestrians, and cyclists, are a leading cause of death and disability globally. These incidents result from a variety of factors such as speeding, impaired driving, distracted driving, and inadequate road infrastructure. Road injuries can lead to severe physical trauma, ranging from minor injuries to fatalities, impacting individuals of all ages. The prevention of road injuries requires a multifaceted approach, including improved road safety regulations, public awareness campaigns, and enhanced emergency response systems. Ranking at number 8, road injuries underscore the urgent need for comprehensive measures to reduce the incidence of accidents and ensure safer transportation environments for all road users. Number 7. Diabetes mellitus. Diabetes mellitus, a chronic metabolic disorder characterized by elevated blood sugar levels, affects millions of individuals worldwide. There are different types of diabetes, with type 2 being the most common form, often linked to lifestyle factors like poor diet and lack of physical activity. Diabetes can lead to serious complications, including heart disease, kidney failure, and nerve damage if not properly managed. The condition requires lifelong monitoring, medication, and lifestyle modifications to control blood sugar levels effectively. Ranking at number 7, diabetes mellitus highlights the growing prevalence of this disease and the importance of early detection and intervention to prevent its associated health risks and complications. Number 6. Trachea, bronchus, and lung cancers. Trachea, bronchus, and lung cancers collectively represent a significant burden on global health, with smoking being a primary risk factor for their development. These types of cancers are often diagnosed at advanced stages, leading to poor prognosis and limited treatment options. Lung cancer, in particular, is known for its aggressive nature and high mortality rates. Exposure to environmental pollutants such as asbestos and radon can also increase the risk of developing these cancers. The ranking of trachea, bronchus, and lung cancers at number 6 underscores the critical need for smoking cessation programs, early screening initiatives, and research into innovative treatment modalities to combat these deadly diseases effectively. Number 5. Alzheimer's disease and other dementias. Alzheimer's disease and other dementias are progressive neurodegenerative conditions that impair cognitive function, memory, and behavior. These conditions predominantly affect older individuals, with Alzheimer's being the most common form of dementia. The hallmark of Alzheimer's disease is the accumulation of abnormal protein deposits in the brain, leading to the gradual decline of mental faculties. Dementia can have a profound impact on individuals and their families, requiring specialized care and support as the disease advances. The ranking of Alzheimer's disease and other dementias at number 5 highlights the growing prevalence of these conditions in an aging population and the need for increased awareness, research, and resources to address the challenges they present. This disease is no joke. It sucks that diseases like this still exist. Number 4, chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease, COPD, is a progressive respiratory condition characterized by airflow limitation and breathing difficulties. COPD encompasses chronic bronchitis and emphysema, often caused by long-term exposure to irritants like cigarette smoke, air pollution, and occupational hazards. Individuals with COPD experience symptoms such as coughing, wheezing, and shortness of breath, which can significantly impact their quality of life. The disease is irreversible and requires ongoing management to alleviate symptoms and prevent exacerbations. COPD ranks at number 4 due to its prevalence, debilitating effects on respiratory function, and the challenges it poses in terms of treatment and disease progression. Effective management strategies and early intervention are crucial in improving outcomes for individuals living with COPD. Number 3, lower respiratory infections. Lower respiratory infections encompass a range of illnesses affecting the lungs and airways, including pneumonia and bronchitis. These infections are often caused by viruses or bacteria and can lead to severe respiratory symptoms such as coughing, chest pain, and difficulty breathing. Lower respiratory infections pose a significant health threat, particularly to vulnerable populations like young children, the elderly, and individuals with weakened immune systems. Prompt diagnosis and appropriate treatment are essential in managing these infections and preventing complications. Ranking at number 3, lower respiratory infections highlight the importance of respiratory health and the need for effective prevention strategies, such as vaccination and good hygiene practices, to reduce the burden of these potentially life-threatening conditions. Number 2, stroke. Stroke, often referred to as a brain attack, occurs when blood flow to the brain is disrupted, leading to damage or death of brain cells. There are different types of strokes, including ischemic strokes caused by blood clots and hemorrhagic strokes resulting from blood vessel ruptures. Strokes can have devastating consequences such as paralysis, speech difficulties, and cognitive impairment, depending on the area of the brain affected. Immediate medical intervention is crucial to minimize brain damage and improve outcomes for stroke patients. Ranking at number 2, stroke is a leading cause of disability and mortality globally, underscoring the importance of awareness, prevention, and timely treatment in reducing the impact of this life-threatening condition. Number 1, ischemic heart disease. Ischemic heart disease, also known as coronary artery disease, is the leading cause of death globally, accounting for a significant number of fatalities each year. This condition occurs when the blood vessels supplying the heart muscle become narrowed or blocked, reducing blood flow and oxygen delivery to the heart. Ischemic heart disease can manifest as angina, chest pain, or result in a heart attack, myocardial infarction, which can be life-threatening. Risk factors for this disease include high blood pressure, high cholesterol, smoking, diabetes, and a sedentary lifestyle. Prevention strategies such as maintaining a healthy diet, regular exercise, and managing risk factors are crucial in reducing the burden of ischemic heart disease and improving cardiovascular health outcomes. Its ranking at number 1 underscores its significant impact on global health and the urgent need for effective prevention and management strategies. Conclusion: in this comprehensive list of the top 10 causes of mortality as of 2024, we have explored the critical factors that pose significant risks to human life. From ischemic heart disease to lower respiratory infections, each entry sheds light on the diverse health challenges faced by individuals worldwide. Understanding these leading causes of death is essential in promoting awareness, prevention, and early intervention to safeguard public health. We encourage you to delve deeper into the intricacies of these conditions and the importance of prioritizing health and well-being. Let this list serve as a reminder of the fragility of life and the power of knowledge in shaping a healthier future for all. Remember, your health is your greatest asset. Take care of it. I better be seeing you all in 2025.